A growing number of measles cases reported. The heated debate continues tonight. To vaccinate or not vaccinate, a question many parents are facing. In tonight's special report, two moms, two different decisions, and a list full of reasons for both of them. Nearly 30 years ago, Beth Luthi almost lost her firstborn. Michael's body would give out on him 4 times before he even turned 2.
I had a lot of hours to sit in a hospital ICU and to think about, I don't understand why he even has this illness. This shouldn't even be happening to us.
For his first birthday, Michael received the gift of life, a liver transplant. But the life-saving procedure would deal a debilitating blow and weaken young Michael's immune system. Michael was essentially defenseless whenever he had to venture out into the community with his mom.
He caught 4 vaccine-preventable diseases that were perfectly preventable, but because the community around him was not vaccinated.
Despite the fact Michael is now 31 years old and has a family of his own, Beth is once again frightened for her son because of a completely preventable disease that has reared its ugly head again. The measles. This year, the numbers are alarming. More than 700 individual cases of measles in 22 states, the most cases of the highly contagious disease in more than 25 years.
We're seeing them come back, and that is because less people are getting vaccinated.
Although there are no reported cases of measles in Utah as of yet, the big question has yet to be answered. Is it just a matter of time? According to Rich Lakin, immunization program manager for the Utah Department of Health, more than 5% of kindergartners in the state are exempt from school vaccination requirements.
We've gradually seen exemptions increase over the years, and from last year to this year, we've seen in kindergarten exemptions, we've seen a 0.5% increase.
Why? Utah is one of 17 states that allow exemptions based on philosophical opposition to vaccination, as well as religious or medical reasons.
Most of our exemptions, like over 90% of them, are personal.
For parents who cannot vaccinate their children because they have a weakened immune system or other medical reason, the number is alarming.
You're so afraid that you're going to run into some airborne illness that's hanging in the air, and the alternative is to risk death.
But despite the dire warning issued by health officials across the country, many parents choose not to vaccinate their children.
Again, I would say personal exemptions are just as valid as any other exemption out there. The debate used to be, should you vaccinate or should you not? The thing that really worries me is the debate has now shifted to, should people have the right to choose not to?
Despite the benefits of vaccines, the Centers for Disease Control and Prevention acknowledges vaccines are not 100% effective, and they cannot be proven 100% safe.
We have had some family members have adverse reactions to vaccinations.
Keeping her children safe is the top priority for Melissa Butler, a registered nurse who has chosen not to vaccinate her children. Health experts point out that adverse reactions to vaccines are rare. However, Melissa has witnessed firsthand the devastation a vaccine may cause more than once.
On my husband's side of the family, one of his cousins had a little boy who had a very severe reaction to the HPV vaccine. It was proven to be caused by the HPV vaccine. He was paralyzed permanently, which was very sad, and he actually ended up, when he was 18 years old, he took his own life because he just had such a hard time with being permanently paralyzed.
Currently, the CDC recommends that children at 11 or 12 years old receive a vaccination against the human papillomavirus, or HPV. According to data collected by the CDC and FDA, 67 million doses of Gardasil, or HPV-4 vaccine, were distributed between 2006 and 2014. The vaccine adverse event reporting system received more than 25,000 adverse reports. More than 7% were classified as serious, and there were a total of 96 reports of deaths after the HPV-4 vaccine was given. The danger associated with the HPV vaccine is what worries many parents when they are faced with the question to vaccinate or not to vaccinate. It's arguably the most important decision a parent can make, and parents should not take it lightly. Now, the World Health Organization listing vaccine hesitancy or the refusal to vaccinate as a top 10 threat to global health just this year.